Chick! Cut!
Owen! Owen! Owen, Rosanna's getting worse. We have to get the doctor.
And what'll he do? Hey? Put her on more pills?
Well, maybe she needs them. Different type, I don't know, perhaps stronger ones.
I just don't want to put in a, you know...
It's only a hospital. And if it does come to that, maybe it's for the best. They'll be able to look after her properly.
You want your own daughter locked away?
No, of course not. But have you thought that maybe a hospital, a specialist one, might be the best place for her? Please, Owen, let me call Dr. Maguire.
Oh, do what you want. You always do, anyway. Come on!
How's your nan?
Up and down. Some days are better than others. She keeps having these moments when she's really, you know, distant. It's frightening. For her as well as us.
I'm sure.
It's not knowing that's what makes it so difficult.
Of course.
I mean, and how long? And I don't want her to feel I'm thinking about that. And we're all trying not to think about it so we can enjoy the time we've got left with her. But on the other hand, you know, I've got to be prepared.
Jo, if there's anything we can do, eh?
Morning.
Another day, eh?
Oh, yeah.
You don't sound too keen either.
Oh, I'm just exhausted.
Busy night?
I've been at the police station most of it. Interesting, but I'll tell you later. I've got a rush. All right.
Is the visit for Rosanna? Oh, I'm afraid Dr. Maguire's unavailable today. He could visit you tomorrow.
Why aren't you doing your visit?
A meeting, of course, tell it.
I'm sorry, Mrs. Barrett, but he can't. Oh, Dr. Mystery could visit if it's urgent.
Oh, I don't know. We usually have Dr. Maguire.
Well, it might be good to have somebody different. Someone who won't just fob us off with useless pills.
Dr. Mystery, then?
Yeah, that'll be fine.
All right, Mrs. Barrett, I'll be over at the end of morning surgery. Bye.
What was that all about?
Well, I can't do visits today. I'm in a meeting. Rosanna's got a few adolescent problems, nothing complicated.
And you've already seen her?
Yeah, I started her on antidepressants this week. Her parents need to be assured that they will work given time.
Well, why can't you do that on the phone?
Because they want a visit. There's nothing complicated, like I said. I'm sure you'll cope.
No doubt I can.
I'm sure he didn't mean that you couldn't.
No? But it sure sounded like it.
Oh, Mrs. Brillis, what can we do for you?
Mrs. Dwyer, why don't you come on through? Bunyan's still playing you up, are they?
Yeah. There's better be an important one.
What?
The meeting.
Clinical governance, why?
Mac, you know that psychiatric problems have a nasty habit of taking up the whole afternoon. No way is that going to be a quick visit.
Exactly, that's why I couldn't do it. I'd have to rush her.
Well, couldn't you have persuaded her to see you tomorrow?
You heard Joe. They want it today.
So Ronnie gets put upon.
Oh, well, he expects it. All part of being a junior.
Oh, you're incorrigible sometimes.
Is that this morning's lot? Better get stuck in if I'm going to make the meeting.
Got my visits through.
Yeah.
Oh, the usual heady mix of infected verrucas, thrombosed piles, and constipation.
And you've got Mac's patient there as well.
Rosanna, can you sit up for me, please? Just want to check you over.
Come on, love. Come on. Come on. Let's sit up so the doctor can take a look at you.
There we are. That wasn't so bad, was it? So what's been the problem then? You been unwell? Unhappy? You're going to have to help me out a little bit here. How about standing up? Can you do that?
Leave me alone.
How long's this been going on?
The last few days.
I see.
She's been off for a few weeks now. We had violent tantrums last week for no reason, and now this. I don't know which is worse.
Perhaps we could talk downstairs.
Are these pills ever going to work?
Well, these things take time. I think we should refer her to a consultant, get a specialised opinion.
What sort of consultant?
A psychiatrist?
So you think she's mad, then?
No, I just think that they have more experience in these sorts of cases. They'll be able to point us in a clearer direction treatment-wise.
So do you agree with Dr. Maguire that it's depression?
Well, it certainly looks like it.
So these violent mood swings, quiet 1 minute, shouting the next, are they normal symptoms for depression?
No, they're not typical, but sometimes happen. We'll get a proper assessment done and perhaps some patient care and...
No!
If it's what she needs,
I am
Owen.
not having my daughter looked after by strangers in one of them places. Whatever they can do there, we can do here. And that's final.
Got those notes that you asked for.
Oh, thanks, Joe. Mike hasn't left yet, has he?
Oh, yeah, you've just missed him.
Oh, I need a word.
I think he's going to be out most of the day as well, which is why Rana's had to do his visits, and he is not very pleased.
Really, why? Oh, it's not the guy with hemorrhoids, is it?
No, it's Rosanna Barrett, psyche patient.
Oh, rather honoured than me. That's hardly a quick consultation.
Exactly. And he's already late for some of his own appointments. So I was wondering...
Oh, no. Don't even think about it. I've got a full day as it is.
Well, then a few more won't make much difference. Please. Helen's got a few.
Joe, I feel sorry for Anna, but I just...
Thanks, Caroline. I knew we could rely on you.
Joe!
I'll send the first one in May.
She loved that pony. She won loads of prizes. Just local stuff, you know, but we were proud of her. Full of life.
Sorry about that, Doctor. It looked like rain. Owen.
Just showing him how she was.
I know, love. But I'm sure the doctor's got much more important things to do than look at old photos.
No, it's okay, really.
You know, I could understand it. I could maybe even accept it if something had happened to make her like this. You know, if she'd lost someone or split up with a boyfriend. But there was nothing.
Well, it would make a lot more sense of things, wouldn't it? If there was something to blame.
I lost my little girl, Doctor. And I have to know why.
And we'll find out, Mr. Barrett. It just might take a bit of time. So when did you first notice that something was wrong?
Oh, about 6 weeks ago. Maybe a bit more. She got these headaches, but they seemed to go, and then she started to not quite be herself, behaving quite strangely.
In what way?
Well, she said she couldn't think straight. The simplest task became really difficult. She said she couldn't concentrate. I said she should go and see a doctor. But she went all moody on me. Told me to leave her alone, so I did. I should have insisted, shouldn't I? I should have made her.
You couldn't have done. Anyway, she's old enough to make her own decisions now.
Oh, maybe. But she obviously wasn't thinking straight.
Well, you know that now. Don't be so hard on yourself. You're not to blame.
We left it too long. By last week, she'd hardly come out of her room. She wasn't eating nothing. Nothing. And that's when Vi decided to take her to see Dr. Maguire. And he gave her the pills.
And she's definitely been taking them.
Oh, I'll make sure of it.
Well, like I said, these things take time. They're not an overnight cure, no medication is. And in the meantime, I'll make an appointment with the psychiatrist.
And how long will that take before we get an appointment?
Well, if I stress how urgent it is, hopefully we should get an appointment pretty much straight away.
Where will this appointment be?
Don't worry, Mr. Barrett. She's not going to go anywhere for now. I'll tell the psychiatrist to make a domiciliary visit.
And what will happen if the psychiatrist decides she will need to be admitted?
Well, she won't be. End of story.
But Owen...
No buts, Vi.
Hello, Maguire, please. Cheers, thanks. Can I have black coffee? 2 sugars. No sugars. Thank you. There. Oh, thanks. Group.
Oh, don't worry about that.
You know, Doctor, I can't help feeling that there's more to this than just depression.
Will you stop tormenting yourself, Owen? Both Dr. Maguire and Dr. Mystery have seen Rosanna and they both say the same thing.
I know, I've just got this feeling that there's something more.
Well, then if it is, the psychiatrist will soon find out. Dr. Mystery's been here long enough.
Oh, that's all right. All the signs are there for depression. But if there's anything else, however insignificant, then please.
Well, she's become quite clumsy. She's forever dropping things.
She was so upset when she broke that glass vase, wasn't she?
She made this vase for Vi's birthday a few years back. She was laying the table and she had to move the vase. And she got hold of it and she just seemed to lose her grip and it smashed.
She said her fingers just went numb, that she couldn't feel the vase.
Anything else happen?
Well, a couple of times she couldn't do her laces up. We had to help her. Poor thing, she must have felt so useless. And of course that didn't help with the moods. But this numbness, it just seemed to come and go. And more often than not, she was fine.
So her hands just went numb?
And her feet as well. They went hot and cold.
Do you think there's anything in this?
Possibly.
You mean it might not be depression?
Well, there's a possibility it might be physical. So you didn't tell Dr. Maguire any of this?
Well, we didn't think it was important.
Well, don't worry, it might not have made any difference. After all, it could still be psychological. Let me take another look at Rosanna, and perhaps we should do some tests before we get her to see the psychiatrist.
I told you it wasn't just in her mind. I said she was ill.
How was the meeting?
Dull.
Useful dull or just dull?
Mind-numbingly dull. All right, eh? Did you manage to reassure the Barretts?
Actually, I was going to talk to you about her. I'm not convinced that she has simple depression.
What, you mean she's deteriorated?
Almost completely withdrawn, verging on the catatonic.
Well, she obviously needs an urgent psyche assessment. Have you done that?
Not yet.
I'll do it then.
Mac.
No, I'll call David. See if he'll do a domiciliary. Or you might want to have her admitted.
I was going to call for a psychiatric assessment, but I want a neurological assessment done first.
Why?
Because I think it's possible that there's something physically wrong with her. Perhaps a virus or a disease.
She's acutely depressed.
As I said, I'm not convinced.
Can you back up your theory? Give me one symptom that couldn't be functional in origin.
I'm not saying that they couldn't be functional. I'm saying they could be due to a neurological disorder.
And how likely is that? Come on, Rana. One symptom. You can't, can you? I know. I've examined her.
And you couldn't have missed something, could you?
You are letting Mr. Barrett's attitude sway you.
I saw her, Mac, and I'm referring her to the neurologist.
I'm her doctor,
You asked
Rana.
me to see her, which I did. I've made my assessment, and this is what she needs.
Or is it what you need? To prove me wrong? No, okay, look. What if it is acute depression? Do you realise how dangerous that can be? What about suicide?
I know what I'm doing, Mac. I'm a qualified doctor, in case you'd forgotten.
Such a way with people, eh, Mac?
Don't you see? If there's a physical reason for all this, it can be treated.
Yeah, they can treat mental illness too.
Yeah, but it's not the same, is it? You can never really say you're cured. There's always that lurking doubt, that stigma.
You've only got to look at her. How can it be physical? I think we should let her go into the psychiatric hospital. Let them help her.
No, she is not mentally ill. Dr. Mistress said so.
No, he said it was possible that she wasn't. Don't get your hopes up, love.
You wanted to be admitted to the psychiatric unit, don't you?
Owen, I need a break. I can't look after her on my own.
Well, I'll help you. I'd rather give up the farm than have my only daughter locked up in some loony bin.
And how will we live then?
That doesn't matter. Look, my daughter's in there, sick and helpless. She needs her dad. That's the only thing in the world that matters to me.
Yes, Mrs. Barrett, I'll be right out. What?
Are you sure you're doing the right thing?
Right for who? Rosanna or Rana?
He's your colleague. You can't just go in and undermine his diagnosis.
She is my patient.
And you asked Rana to see her.
Well, Mrs. Barrett asked me to see them. She is not happy with Rana's opinion. He raised Mr. Barrett's hopes.
Are you absolutely sure he's wrong?
Kate, I know Rosanna. I've known her all her life. I've watched her through all the stages. We've talked about love, about periods, and about acne. Well, now she's had a breakdown, and she needs to be admitted for psychiatric treatment. I should never have sent Rana. If I am late back for evening surgery, you will have to apologise to my patients, and they'll have to wait. See ya. organised a visit from Dr. Sanders after his surgery about 6:30.
And he's...
He's a consultant psychiatrist.
So you don't think Dr. Mystery's right about it being a physical illness, then?
I'm sure Dr. Mystery was doing what he thought was right.
Owen desperately wants him to be right.
Yes, I know. But she can move, can't she? When she wants to. And feel things. Her reflexes aren't impaired.
And the tingling?
Look, I honestly don't think this is a neurological disorder.
Will she need to go into hospital?
Ah, well, that's up to Dr. Sanders. He's the one to decide that.
I can't look after her here anymore.
And your husband?
He thinks I'm trying to get her put away.
Well, he agreed to let me visit. He does know I'm here, does he?
He's up on the top field. I don't want to bother him.
Well, he has to let us treat her. As an inpatient, if necessary.
It'll break his heart if she doesn't get any better.
You have to persuade him to let Rosanna be admitted. For all your sakes, but especially for Rosanna.
That's terrific. I didn't expect you to have a bed so soon. Well, thank you very much. Bye. Mrs. Barrett, Dr. Mystery here. I've arranged for Rosanna to be admitted to St. Phil's this afternoon. At the neurology unit, yes. Dr. Maguire, when? Mrs. Barrett, I think it's important that Rosanna has these tests. I do understand...
Just having to do a little bit of swapping round.
When Mac gets back, tell him I want a word. Oh, and if I'm late for my evening patients, apologise for me. And blame Mac. I can't stress to you the urgency of these tests. They need to be done.
The minute my back's turned, eh? Why?
I did what I thought was best. Now I don't know what to think. You say one thing, Dr. Maguire says something else.
It isn't a question of believing one or the other, Mrs. Barrett.
Well, one of you has got to be wrong.
But diagnosis isn't that simple. That's why we have all these tests, in order to narrow things down.
Yeah, but she could have these tests at the psychiatric hospital, couldn't she?
Of course. But the reason I want Rosanna to have these tests done before she goes to the psychiatric unit, if she goes, is because of the drugs they'll use.
How do you mean?
The drugs the psychiatrists will use can distort the results of the tests the neurologists do.
Oh, they won't be able to tell what's wrong.
It makes things harder. That's why I want the test done first. Not because I'm convinced her problems are physical, but if they are, we stand a greater chance of finding out.
But Dr. Maguire was so sure.
Aye. Maybe too sure. At least this lad's been honest, admitting he could be wrong.
OK, but whichever order they're in, they'll still get to the same diagnosis in time.
We may not have time.
Why?
One of the possibilities, just one, is that she may have a brain tumour.
I'm taking her in now.
I'm really sorry, but Dr. Mystery has been unavoidably detained and his surgery is running late.
My son's supposed to be at school.
If you would like to make another appointment, come and see me.
Well, that's not good enough, I'm sorry.
And before you ask, I'm not taking on any more of Rana's patients.
I know.
Rana's still not at Mac's psyche visit, is he?
Yeah, he went, he came back, then Mac went, Mac came back, and now Rana's gone again.
What? Well, they've had a disagreement about how to treat her.
Do you mind calling back in about...
When is it?
Such a long time.
Is this it?
Waited too long. No.
Don't ever do that to me again!
What?
Treat me like some overeager, misguided schoolboy.
I didn't.
You should have discussed it with me before you went round to see the Barretts.
Yeah, you're quite right, I should have. But admit it, you didn't make it easy.
Did you?
Well, I tried to talk about it earlier, you went off on a huff.
You weren't prepared to listen.
That is ridiculous.
Is it? You were so sure that you weren't wrong, you hadn't missed something. Well, here you go. Numbness, tingling, pins and needles, clumsiness. All neurological signs.
Then why didn't you say something?
You didn't give me a chance.
Anyway, these symptoms, they could be due to mental illness.
Absolutely. But they could also be due to a neuromalfunction. I'm just being thorough.
Like ordering unnecessary tests, raising Mr. Barrett's hopes.
I think they're necessary.
Rana, in my very limited experience...
Oh, that's what this is all about, isn't it? You don't like the fact that someone younger and less senior might actually be right.
I know Rosanna and I know the family and they trust me. And as you will realise for yourself, that sort of trust takes years to build.
You are patronising, interfering, and wrong, Mac. And you better cancel that psychiatric assessment. Because Rosanna's been admitted to St. Phil's for neurological assessments. That's how much the Barretts trust you.
Have you got a moment?
Ah, you have a contribution, do you? To this Let's All Have a Go at Mac Day.
What do you expect? You undermined Rana's position.
Nonsense. We disagreed about a diagnosis.
You tried to overrule him.
I'm the senior partner.
Well, does that mean the rest of us can't have an opinion?
No, but she is my patient.
Oh, and that makes it right, does it? I'll remember that next time I visit one of your patients.
That's not what this is about. This is Rana having to prove himself all the time.
And why does he feel the need to do that?
I have no idea. Medicine is not a competition, or at least it shouldn't be.
No. He's a good doctor, and we need him here.
Did the neurologist talk to you about the results?
Well, to be honest, we're none the wiser. It was all a load of gobbledygook to us.
But we understood the most important thing, that it's not a brain tumour.
That's right.
And that's good, isn't it?
Yes, but...
He was quite sure. He said it wasn't a brain tumour.
Did he tell you about the other possibilities?
Well, we didn't like to ask what that was. He was so busy.
He said there'd be more tests.
That's right. With the symptoms Rosanna's presenting, it's not definite, but early results indicate that she may have variant CJD.
The test indicates CJD. It could be something else.
There'll be more tests, of course, but...
Would it have helped if we'd got her here sooner?
I don't think it would have made any difference, Mr. Barrett.
But how did she get it? Could we have done anything?
We don't know enough about it, except that she probably got it a long time ago. Sorry.
Is she suffering? Is she in pain?
Does she know what's going on?
I suppose it'd be better if she didn't. She'd only be frightened.
Yeah, but it'd be a comfort if she knew we were here for her.
I'm sure she does.
How long's she got?
Weeks, months.
Oh.
Who can say? I wish I had the answers, but I haven't. I'm not sure anyone has.
So sudden. So little time. I can't bear the thought of losing her.
We already have.
What are you doing here?
Well, same as you, I expect.
Really?
I've come to apologise to the Barretts.
What for?
They should never have been stuck in the middle like this. Whatever our disagreements, they should be kept from their patients.
I agree.
Oh, good. Well, I'll go and have a word then.
I don't think that's a good idea, Mac.
What do you mean?
They might need a bit of time to come to terms with the diagnosis.
Diagnosis?
It looks like she might have variant CJD.
What? God, poor kid. No, but it can't be.
Why not? Because you didn't diagnose it? Admit it, Mac, you got it wrong.
Yes, all right, I admit it. I got it wrong, but it doesn't change things, does it?
You just can't come out and say you're sorry, can you?
Oh, is that what you want? I'm sorry. Better?
Just don't get it, do you?
Have you spoken to Rana yet? Apologise to him? You didn't, did you?
I did.
But?
I tried, Kate, honestly. I apologised. What does he want? A full page ad in the papers. I was wrong and I told him so. What more can I do?
Maybe congratulate him on his diagnosis.
Goes without saying. He knows he's done a good job. Doesn't need me to tell him.
What are we going to do with you, eh, Mac?
I can't stop thinking about Rosanna Barrett. I made a bad call.
So he apologised?
Begrudgingly. It's not about saying sorry.
No, I know.
He just can't credit me with being right. He can't bring himself to...
Say well done?
Exactly. I could try and trust my judgment at least. But he never will. To him, I'll always be the junior.
No, you won't. It's just, you know what Mac's like. It takes him ages to...
Trust, respect someone?
That's not what I was going to say.
Yeah, you were. You were just looking for a gentler way of saying it. Well, I don't know if I can be bothered to hang around long enough to earn his respect, especially when I think I deserve it. Besides, I don't want to be a junior for the rest of my life.
No, I know. So, what are you saying?
I'm seriously considering my future in the practice.
Look, don't rush into anything. You've just had a bad day, that's all.
Of course. Don't worry, I'm just getting things off my chest, that's all. Nothing's anywhere near decided yet.